There are a lot of causes of shoulder pain. Fortunately, the minority of the causes are surgical, meaning most of the reasons that you have shoulder pain we can treat without surgery. The first thing we have to do, though, is make a diagnosis. And so usually that is made from a physical exam. We also listen to you talk about your shoulder and how it started hurting and how it feels. And that can give us a lot of clues. And then we usually proceed with imaging. So we start with a plain x-ray, usually the most basic test we do. And we get that x-ray back, and we can usually tell if someone has severe arthritis, or a lot of times the shoulder x-rays look fine. The next step after that would be either an ultrasound, which we can do in the office to see if there is a rotator cuff tear or maybe a labrum tear. If we need more detailed information, we order an MRI. Sometimes we inject dye into the shoulder to get the MRI, and sometimes we get what's called a plain MRI. An MRI can give a lot of detail in the shoulder. We can see rotator cuff tears, whether it's a full tear or a partial tear. And when we usually see the patient back after the MRI to review the results, we basically give the series of options. And most of the time, the first option would be some sort of a injection, either a steroid injection or a regenerative medicine treatment, such as a PRP or platelet-rich plasma injection. And then sometimes the patient just needs some physical therapy. Sometimes they can do a home therapy program. And then the minority of the time, or less than 50% of the time, we'll see something on the MRI that says the patient probably is going to need surgery and won't improve without actually getting surgery. And we'll give people percentages on, we think therapy has a 20% chance of working, or a 50% chance of working, or an 80% chance of working, for instance. We're not going to prescribe therapy or an injection if we don't think it's going to do any good, basically if it's a waste of time. But if there is a tear on that MRI that needs surgery, for instance, then we'll have that conversation with the patient. And most of the time, or the vast majority of the time, surgery is not the only option.